Anxiety disorders. They impact nearly 20 million people in America alone. In fact, they are the most common psychiatric disorders affecting both children and adults. And with the increasing stress of living in the 21st century, on both a global and personal level, this subject is getting more attention than ever. There are several anxiety disorders identified in the Diagnostic and Statistical Manual for Mental Disorders, commonly known as the DSM. Though they share a common theme of excessive, irrational fear and worry, each anxiety disorder has its own distinct features and challenges. In this program, we're going to explore what is called obsessive-compulsive disorder. Bob has an uncontrollable need to check things over and over.
Bob, come on, we're late.
I'm coming, honey, don't worry.
To the point where it takes up quite a bit of his day. Wendy is a college student obsessed with contamination. She worries constantly about germs and cleanliness. These two individuals have obsessive-compulsive disorder, commonly referred to as OCD.
We hear examples of people who can't stop counting, people who can't stop washing their hands, people who can't stop checking the doors to make sure things are locked. Now, the definition of obsessive-compulsive disorder is, in fact, that it impairs your functioning in some way.
You might wonder, what does that have to do with anxiety? And the rituals are a way that this person will manage their anxiety.
For years, mental health professionals thought of OCD as a rare disorder. However, many people with the disorder had simply failed to seek treatment because of their desire to keep their thoughts and behaviors secret.
They're not oftentimes willing to disclose it to family, who of course see the symptoms but may not know what it is. And they're oftentimes not so forthcoming to reveal the symptoms to physicians, for instance, because, for instance, much of the ritualistic behavior, the compulsions of OCD, tend to be quite embarrassing and also distressing to the individual.
Surveys revealed that actually more than 2% of the U.S. population has OCD, making it more common than schizophrenia, bipolar disorder, or panic disorder. Today, it accounts for nearly 6% of national mental health costs. As with all of the anxiety disorders, there are several specific criteria in the DSM that establish what constitutes an obsessive-compulsive disorder.
So you feel you have to clean your apartment every single day? Well, not just clean it. I mean, I have to, disinfect it.
One is that the individual must show signs of either obsessions or compulsions, which we will later define in more detail.
I know it might seem crazy. I just can't relax unless I'm doing that.
The next criterion, which only applies to adults, is that at some point during the course of the disorder, the person has recognized that the obsessions or compulsions are excessive or unreasonable.
Bob, I don't want to be the last ones there.
I'll be there.
Another criterion is that the obsessions or compulsions caused marked distress, take more than an hour a day, or significantly interfere with the person's normal routine, occupational or academic functioning, or usual social activities or relationships.